Hi, thank you so much for tuning into our fourth live video for National Suicide Prevention Month. Today we'll be discussing suicide in the BIPOC community, and we're joined by a few of Centerstone's experts. I'd like to go ahead and make a disclaimer that most or all of us are working from home, so you might hear some background noise such as kids or cats or dogs or anything, so please bear with us with that. And I'll give it a few more seconds and then we can get started. All right, great. So I think we can go ahead and get started now. So I'll go ahead and introduce myself. I'm Michael Sostre, and I'm the PR coordinator for Centerstone. And I'm joined by some folks who are here to talk about suicide in the BIPOC community. So I'll go ahead and turn it over to Veronica to introduce herself, and then we'll let our other speakers introduce themselves as well.
Hi, my name is Veronica Gibson, and I am an intensive in-home therapist for Centerstone, and I am also the chairperson for the Black and Brown Professional Network.
Awesome. Now I'll go ahead and let Michelle introduce herself.
Hello. Hi, everybody. My name is Michelle Strachan-Wildman, and I am a crisis care clinician for the Target to and Connect to suicide prevention programs here at Centerstone. And I also work part-time on the crisis line here at Centerstone. And I'm also a member of the Black Professionals Network.
Awesome. And now I'll go ahead and let Vicky introduce herself as well.
Hello, my name is Vicki Coleman. I contract with Centerstone through the TIES program. We do in-home therapy with our families, 8 to 10 hours a week intensive. I'm also a member of the Black Professional Network within Centerstone. And welcome, welcome, welcome.
Awesome. So just before we get started, I wanted to go ahead and say that there will be some crisis line information in the comments of this Facebook Live video, and then additional information will be added throughout the conversation. So if you're ever looking for any of that, you can just look in the comments and you'll be able to find something. And with that, I'll go ahead and get started with the first question. So the first question will be for Veronica. So suicide is the second leading cause of death among Black Americans ages 15 to 24 and is the top leading cause of death for Asians of the same age. Can you talk about some of the reasons why this might be?
Yes, some of the reasons is just lack of insurance, the lack of access to being able to get to a primary care physician or a mental health doctor, single parents not being able to take off work, just transportation. Sometimes childcare is an issue. We really have to get the resources and the education out there so that we can bring awareness to help prevent suicide.
Yeah, definitely. Sounds like there's definitely some specific barriers within these kinds of communities. And I know another barrier that is fairly pervasive within BIPOC communities is stigma surrounding suicide and mental health. So Michelle, could you please talk about that a little bit and how that might affect people in the BIPOC community, and if maybe that stigma is kind of increased, if it's more or less prevalent within the communities?
Yeah, absolutely. So just before I begin, the BIPOC, for those who don't know, stands for Black, Indigenous, People of Color. So we're talking about not just Black people, but just people of color, who are considered minorities in this country. And talk about stigma and fear that affect these communities. That is absolutely a truth, something that happens in those communities. So, we talk about people of color. There are different types of cultures housed in that, right? So it's not just Black. There's Hispanic. Want to put Asians in there. Because all of these communities are considered people of color, minorities, I should say. So stigma and fear is pervasive in our community, and it is definitely, it's also based on the different cultures that we have in our community. So in some other cultures, mental health issues are considered maybe a spiritual or religious issue, right? So it is dealt with more from a religious side. So instead of seeking out a doctor, you may seek out a pastor or some kind of, spiritual advisor. For some, it is viewed as it's a physical health problem, right? Because there's some mental health conditions that do present as physical health issues, right? So help might be sought for the symptom of the physical health issue and not necessarily, thought about as maybe it's because I'm depressed or I'm anxious or things like that. And also there's some, some stigmas where it's like, oh, you're just lazy. It's all in your head. You're making it up. You're looking for attention, all this stuff. I've heard all of that personally, in my work here at Centerstone and other places that I've worked. So is stigma and fear a barrier for treatment in the BIPOC community? Definitely. And, it presents in different ways. So yeah.
Awesome, thank you. Yeah, it sounds like that is definitely a barrier. And I know another barrier that Veronica briefly mentioned a second ago was maybe education. And there is evidence that there are inequalities in education within minority communities and BIPOC communities based on just a variety of factors. So how does being less informed about physical health potentially lead to problems with mental health? And Michelle, you can answer this as well, or Veronica or Vicky, whoever wants to.
Well, I think that because of the fact that people of color don't normally go to the doctor as much and get all the resources that they can have. Because I know when I go to my primary care physician, she actually asks me about, anxiety and depression and, how I'm feeling mentally, if I'm, fatigued or drained, or if it's physical exhaustion or mental exhaustion. So those have just been some questions that, I have experienced over the years with, me keeping my annual appointment. So if you're not making the appointments, the annual checkups and stuff, you could be missing out on that piece of the information.
Yeah. And to kind of add to that, one of the reasons why people in the BIPOC community are perhaps not willing to go to doctor or seek out medical help is there is a fear and a mistrust of practitioners, medical and mental health, and that stems from a long history of slavery, just to be honest, the history of this country. If you look at, there's been definite abuses of people of color, especially Black people, when it comes to the medical field, starting from slavery and even after slavery. So there's a definite fear of people of color going to the doctor. Not just lack of access. That is definitely an issue. There's a lack of access, lack of resources. Not many people are able to afford insurance. Medications are expensive. All of those things are barriers, right? Transportation, all of those things. But there's also a definite fear, and there's also discrimination and bias on the parts of practitioners, to where some people of color that's been to the doctor, they've experienced it. And so they just say, you know what, I'm not coming back, so they get left behind, fall by the wayside, and they do not get the care that they need because there is that fear. So,
and I believe shame also plays a part in that fear.
Yes.
Shame of somebody knowing that someone in my family has a mental health issue, and shame has been a big, I would say, a big symptom of lack of getting mental health help assistance in the Black community, because of the shame of it,
Mhm.
you know. But I want to say today, there's no shame in it. Just like there's no shame in being physically sick.
Mhm.
There's no shame in being mentally sick,
Mhm.
you know. And we are 3 Black professionals here that are willing and wanting and ready to help our community. And not only the Black community, but the Indigenous community, the Asian community, the Hispanic community, the white community, you know, because we help all the community. We help every race at Centerstone.
Mhm. Mhm. Yes.
So would you say, what are some other ways, Vicky, that we could maybe encourage people to seek out that kind of help despite different barriers that they might face?
You know, I believe knowledge is a powerful thing. You know, and sometimes we don't do because of lack of knowledge. You
Mhm.
know, and some stats I like to give today in the non-Hispanic American Indian and Alaskan natives, they have the highest rate of suicide among all racial and ethnic groups. You know, so that's really high. And in the Black and Hispanic community, suicide is the second leading cause of death. In the Black community, among people ages 15 to 24, and in the Hispanic community, among ages 15 to 30 to 34. You know, that's a wide range, you know, of people who are feeling hopeless and are needing help. You know, and what I say is we have to take care of ourselves. And taking care of ourselves is not just physical health, but it's also mental health,
Mhm.
you know. So I encourage Black, Indigenous, and people of color to not only take care of yourself physically, eating well, drinking enough water, but also mentally, you know, getting help when you feel hopeless, crying out to someone, asking for help. There's no shame in asking for help because I believe nobody can live alone on this earth. We all need somebody.
Mhm.
So just educating yourself, understanding the need within the community that others around us are feeling hopeless.
Yeah.
That's awesome. Yeah, definitely education is a great first step. Thank you for all that encouragement. So definitely another thing that people within these communities face, just because of their position within the country and the world, is sometimes they face race-based traumatic stress through just different events that they have in their life. Um, and so how does this specifically affect someone's mental health and risk for suicide? And any of you can speak on that as well.
Race baiting, you know. I want to give an example just from my own life experience and things I've shared with white friends of mine, you know, and it just takes, as Michelle has said earlier, the spiritual part of my life, what helps me stay stable. But you know, I've been in this field for almost 20 years, and you know, most of my clients, the majority of my clients are Caucasians, and I go in there and I give them everything I have because I want them to become have a equilibrium, a balance in life, you know, with their family and then as an individual, you know. So sometimes just within myself, I have to just make sure I'm walking in my goodness, so I can make sure I'm giving out love, you know, to everybody, even though there are times I've been in places where I didn't receive the love back, you know, but you still have to give as a professional. You still have to do what your calling is, and my calling is to help, you know. So and the fact of the race baiting and the racial disparities, they're there. They've been there, you know. And I'm so happy that Centerstone has opened the door for us to be able to communicate about that.
Yes, yes. And just to add to that, Vicky, I definitely agree with everything you said. And you know, as people of color, right? The us three ladies are all women of color, having to live in this skin and live in our bodies every day, and also provide mental health care to people of all races, backgrounds, cultures, and all of that. You know, it can be difficult. I can share several examples from my personal life about how race-based trauma has affected me personally, you know, and not to mention my clients, you know, family members, friends, all of that, you know, but it definitely is a real thing. It can cause anxiety, panic, you know, sleep, insomnia, depression, you know, all of those things, you know, because, you know, let's use what's been going on, you know, the past few months, you know, in the country. When you have to sit and you watch on TV play out in front of you on social media,
It's hard.
TV, wherever, see people that look like you being targeted, killed, just because of how they look like you. It makes you wonder, am I next? Is my father, brother, sister, are they next? My clients, you know, so it's something that we as practitioners, we have to deal with. We have to take care of ourselves, and, you know, so that we can be healthy to provide care to to all of our clients, you know, but it definitely is a real thing. And all the things I mentioned, it can anxiety, depression, you know, and then also, you know, because we are Black women, you know, on this panel, you know, we come from a history of slavery, you know, trauma is passed down in our bodies, you know, in psyche is passed down, you know, and so you're dealing with that, you know, then you're seeing it play out in front of you and you're wondering, you know, when is it going to end? You know, why, you know, yeah. So it definitely is a real thing. And there has been a lot more discussion around race when it comes to in our crisis department, because I work in the, you know, we work in the crisis department, and working on the crisis line also. Yes, we have seen, you know, an increase in calls, people talking about it. You know, I've taken calls from people where, you know, they're sad, they're depressed, they're afraid, you know, and of course, we're coupled with the COVID-19 pandemic. You know, there's a lot of fear and anxiety and things like that. So yeah, that's a conversation that I have almost daily with clients in some way, you know, and it's not, and I know we're talking about the BIPOC community, but, you know, Vic, you mentioned about our white brothers and sisters. They also have talked about it too, which is something that's been a beacon of light for me. Centerstone has provided the platform, you know, for us to discuss these issues amongst ourselves and with each other. You know, and we have the crisis line where you can call and discuss these issues too. You know, if you're feeling, you know, if you have questions, you're fearful, all of this stuff, you can always reach out, you know. So you know, so is it a real thing? Absolutely. Are people talking about it? Absolutely. Are people feeling it? Absolutely.
Right. Thank you so much. And it definitely sounds like you don't even yourself have to experience someone doing something traumatic toward you, as long as, I mean, if you see it being done to people who are similar to you in any way like that, it's already traumatic for you.
Yes.
So, right. Thank you for your answer. And also, as Michelle just said, Centerstone is trying to be front and center with a lot of these issues, and trying to help people within these communities. As we said, Veronica is the chairperson for the Black and Brown Professionals Network, one of the employee resource groups. So Veronica, you've mentioned that you look forward to expanding community outreach efforts as part of this group. So could you tell us a little bit about what that might look like?
So the Black and Brown Professional Network, we hope to be able to collaborate with HBCUs, Black student unions, different ethnic organizations, on colleges, or just out in the community, so that we can have the access to some of the lower income communities to be able to provide education and resources, so that, when they are in crisis, they know where to go, who to call, how to contact people. And the only way that we're going to be able to do that, we have to tap into these communities. So basically, we're just going to have to get up and get out there and get amongst the people. And that's something that I am hoping that the Black and Brown Professional Network, along with our allies and our other colleagues of, that are not colored, with their support, we can get out there and do that through, charitable events, looking at some blood drives, just doing different things out in the community to bring awareness and education, so that we can start trying to get ahead of it and be proactive instead of reactive. And maybe we can, prevent some of the suicide rates and look at some decrease in the future.
Great, thank you so much. So is there any kind of extra precautions being taken because of COVID for that, kind of getting into the community and serving in this kind of way?
Well, definitely, once we are able to bring it together and get out there, we will be wearing masks and, taking the necessary precautions that we need to take in order to keep everybody safe. Right now, it's just something that, we're tossing around that's on the table. So I don't know if it'll be, while we're in the midst of COVID or post-COVID, but it is definitely something that is in the works that we are wanting to do as a network.
Awesome. Thank you so much for your leadership with all that also. That's really great. So also, Vicky, throughout this whole chat, you've been providing a lot of encouragement. So what would you say to people who are part of the BIPOC community that might be having a hard time right now, just in general, with anything going on this year or otherwise?
Yeah, I would say to you, if you're feeling hopeless, if you feel like giving up, wait, don't. There is help. There is hope. Centerstone, we're here. We care and we will help. The number is on there. You can see it. I believe he's putting the Centerstone hotline is 1-800-HOPE 123 1-877 HOPE 123. Call the number. We're waiting to help. Centerstone also have what we call a path, and that's a program for those who have been who are having suicidal ideations, which are suicidal thoughts, or have attempted at one point in time. We have a great program here, and all you have to do is pick up the phone and call, and we are here ready to hear your story. Because sometimes all you need is somebody to hear your story. We want to hear your story and encourage you to keep on keeping on for a little while longer. Don't allow shame to be your leading force. Help is available. You see Veronica here, Michelle, myself, and there are other wonderful, wonderful therapists and clinicians, doctors and nurses at Centerstone. So my encouragement is there is help. Pick up the phone call, find a friend, a family member you trust, somebody you can talk to, because there is hope.
Thank you so much. So another question that I have, and this one can go out to anyone. So as we are trying to spread that message of hope to people, what should people listening know about certain warning signs of suicide so that they can actually help someone out?
The thing about suicide is you have to be straightforward and blunt. You can't beat around the bush. You can't play with it. You have to come and say, hey, do you want to kill yourself? Or are you ready to die? Have you made a plan? Do you have a way of doing it? you know, and sometimes you would notice people doing things differently, like giving away stuff that's important to them. You know, we just have to pay attention to people, you know, mood swings, you know, being a little more sadder than you normally used to them being, you know, increased use of drugs and alcohol. You know, that's a sign of something is just not right. And I'm gonna let the other two ladies share some things too.
Yeah, and also to add to what you're saying, Vicky, yes, definite mood swings in either direction. So if you know someone that's been withdrawn, sad, right? You've noticed those warning signs, but then you notice a switch into the other direction. That's also a warning sign, you know, because sometimes when a person has decided that they're going to end their life, that can bring a sense of peace to them, you know, and they'll come out and they'll start having fun with family members and friends, doing things, and people are like, oh wow, they're getting better, you know, and then you find them dead. You know, I can think of some high profile suicides that have happened, you know, in the past recent years where family members were shocked, you know, because they seemed happy and they showed photos of the night before they did, you know what I mean? They were smiling, you know? So yes, definitely, you know, look out for warning signs, mood changes, giving away things. And definitely, like Vicky said, you know, you have to be straightforward and ask. Don't be afraid to ask. I have heard so many people say, you know, in my practice that, well, if I say that, you're putting the idea in their head. Trust me, it's there already. They've been thinking about this thing for longer than you know. Suicidal ideation, self-harming, those kind of things live in secrecy. So if you don't draw it out into the light, it will thrive. So by asking direct questions, talking about it, and I know it's scary for family members and friends because you don't want to think of your child, your loved one, or whomever in that light. But those are things that, you know, they've been thinking about. And by keeping it quiet and not saying anything, oh, we don't talk about that in this family, you know, or a family member that has died from suicide, we pretend like it never happened. And I've known some families who lie about the way the person died because of the shame and all of this stuff. You know, it thrives in secrecy. Don't be afraid to talk about it. Be straightforward. Ask the questions. Look for the signs. Don't lecture. Don't shame. Don't tell them, oh, don't think that. And don't use those statements. You know, try your best to come from a place of understanding and definitely reach out. We have a 24-hour, 7-day-a-week crisis line you can call, right? Centerstone has. You can call somebody. You know, there is help available. You know, Centerstone offers therapy services and all kinds of things. You know, I work for a suicide prevention program. So that's what I do all day, every day, right? And then PRN on the crisis line. So I live and breathe that. You know, there is help. You know, be straightforward, ask the questions.
It can be as simple as just asking a person if they are okay.
Yes.
There's only been one person that has jumped off the Golden Gate Bridge and survived. His name is Kevin. When Kevin tells his story, he says the difference of him jumping and not jumping that day would have been if the many people that walked past him would have said, "Are you okay? Are you okay?" Check on your loved ones just to see if they're okay. They may not know how to come to you, but if you just ask that question, that may open up the door for them to share with you what's going on.
Great. Thank you all so much. So in light of all of that, when it comes to maybe someone that you know experiencing a crisis who's different from you, let's say like a different race or ethnicity or anything, how might that adjust how you approach supporting that person?
You know, I don't think it would have to be much of an adjustment. You would just go in and do what you do for any person, because suicide is suicide. You know, suicide don't care whether you white, black, Asian, Hispanic. You know, so I would just go in with the heart of love would be what I would carry into every situation. You know, I wouldn't change my method. I would just make sure I'm doing it from my heart. You know.
And also one of the things I didn't touch on in our previous um, conversation was definitely cultural competency, right? Because yes, we're all one people, right? Our goal, especially in this country, is to get to a place where all people, right, are equal, but we also have to remember that there's different cultures within our people, in the BIPOC community, and definitely in our other community, people, our white brothers and sisters, but definitely cultural awareness, and understanding. And part of best practice is knowing your limitations, knowing your personal biases, recognizing them, being honest with yourself. I have not personally met someone of a different color or race that I felt like I could not work with. I've not met one yet, and which I'm grateful for. But definitely, know where your limitations are, and be honest with yourself about your own personal biases and the biases of your clients, because I've encountered that. Of somebody, I'm a Black woman. I've been called the N-word by a client, so that is, that's interesting. But definitely, knowing what your limitations are, being culturally competent, coming from a place of love and understanding. Because like Vicky said before, sometimes all somebody wants is just for you to listen to them, listen to their story, so you can understand where they're coming from. And that has worked for me all the time. Even the clients that at first are difficult, listening and at least trying to understand, goes a long way to kind of break down that wall. And, we can start building a good rapport.
Thank you so much. Oh, go ahead, Vicky.
I said nothing would change, but as Michelle was saying, you have to know the culture too, and you don't go in there just in an Asian family, just looking them point blank in the face and just being really aggressive with them. You have to adjust to your client.
Right. And would you all say that it's the same thing, whether from a professional or even just kind of someone in that person's life, just a friend maybe, that they would need to understand kind of those cultural differences when having that conversation?
Absolutely.
Yeah, absolutely. I think that's what good friendships are based on. You have to understand the different cultures and different, values and things like that, for sure.
Great. Thank you so much. So recently, there's been some news that the 988 initiative has gone through now Congress and is currently about to be signed into a law. And if you don't know what that is, basically that is the National Suicide Prevention Lifeline is adding a 3-digit dial-up number to call whenever someone is in crisis. So this way, people will have a lot easier of a time when seeking that kind of care. So I want to go ahead and ask Michelle, maybe if you could explain what people can expect if they do call a crisis line like that, and also who could call that line.
Well, who can call that line? Anybody, right? It's for everybody, if you need, listen, if you want to talk, you have questions, if you're not sure if, you should call. I mean, I've gotten calls like that. I don't know if I should be calling, you know, and listen, anybody can call, you know. If you're concerned about a family member, we get calls about that. Family members and friends will call, you know, employers will call, schools call, you know what I mean? Because they're teachers. I mean, anybody can call. You don't have to be the one that needs the help immediately. You can call on behalf of a friend or family member. Give the number out. But yes, everybody can call. And as far as your experience, you know, you will talk with trained crisis workers, or especially trained to do this on the phone in terms of the crisis line specifically. They're specifically trained to deal with crisis, you know, on the phone. So they can talk you through, you know, whatever is going on. So, you know, that would be your experience. Whatever is going on, somebody will be there to listen, offer advice if you need it, get you resources as needed, right? Get you to where you need to be, get you in contact with the right people, you know, things like that. So yeah, anybody can call. Yeah, and I'm really excited about the 988 initiative, because it's like the 911 for mental health. You know, I'm glad that it's here. I'll you know, it would have been nice if we had it before, but I'm glad that it's here now. And I think it will be a great service.
Great. And I did want to go ahead and point out that currently 988 is not live yet. It
Right.
is set to be live in about 2 years. So still for now, the National Suicide Prevention Lifeline can be reached at 800-273-8255. But
Yes.
we do really look forward to that being live. Very excited about that news.
Yeah.
Awesome. So again, so pointing it back to the specific communities, within different communities, sometimes there are different myths, sometimes about what people have gone through, and it can even invalidate maybe people's current experiences and trauma. So maybe could I ask any of you to speak on this myth of maybe if for Black Americans kind of historically have made it through slavery, so we can make it through anything. Like, is that kind of, is there any truth to that, or should any kind of mental health issue still be taken just as seriously now?
Just as seriously now, as I believe it was Michelle that stated earlier, trauma rewires your brain, okay? There was some rewiring going on inside of their head that continued as they birthed their children. And even now, you know, with all the murdering and the George Floyd stuff, that didn't just start. It's been going on. You know, but now because of videos and phone cameras, people can see it live and see it happening. Because for years, I believe people have thought Black people just been lying. They're making this stuff up, okay? Because nothing has really ever been done. So either we was making it up, or else white people just didn't care, okay? So, but even now, seeing this, I've been in therapy almost 20 years. When I on purpose don't watch those videos, Facebook, Twitter, I purposely, on the news, I walk out of the room. I got caught with George Floyd, okay? And saw the whole thing, and it took me to a place I had never been before. I had to take 2 days off from work just to kind of cope myself, getting myself together, okay? Never experienced that before. So, so I can imagine a lot of younger people, a lot of older people in the BIPOC just kind of feeling in limbo and like, what can I do? That bear is there and he's coming to kill me, but I can't kill the bear. I can't fight the bear. you know, and that's what that fight flight does. It helps you protect yourself. But when you can't beat it and it keeps coming at you, what do? You know, Michelle.
Oh yeah, no, I was just like, just, you know.
But you know, but all of that is true, and
Yeah.
that's why I believe we as a race, as the not just blacks, but the Asians and Hispanic, we all need to tell our story, because when you talk, healing comes forth, understanding comes forth when you communicate. So I just believe once we, you know, and just like with Centerstone, they've opened this door for us to be able to communicate with one another. Our diversity of not only races, but just people in general, you know. And so the more we communicate and the more we talk to one another, the more we can realize, oh, you put your pants on like I do. You know, you wash your face just like I wash my face. You know, you brush your teeth too. Wow. You know, we are all people.
Yeah. And you know, Michael, to add to what Vicky said, yes, our Black ancestors, yes, they made it through slavery, right? Because all the Black people were not wiped out the face of the planet. Yes, that is true. However, you know, trauma is something that you don't get over, right? And slavery is one of the most horrific traumas. Not only is it horrific, it lasted so long, you know? And, you know, since we're in the United States of America, you know, even after the slaves were freed, right? Yeah, the chains were taken off, but that's all that happened. You know, didn't have full rights. You were still considered what, 1/8 of a person, still treated like less of an animal. You know, we were still hunted down. You know, a lot of Black people did not know what else to do. So what did they do? They returned back to the plantation as sharecroppers, right? So prison systems were built to imprison, you know, Blacks, you know, bring them back into slave labor. You know, you charge them with crimes, put them in jail, bring them out to do slave work, to do the work, you know, as slaves, you know? So trauma is not something that you get over, you know? And yes, it is true. Yes, Black people, you know, we made it through, you know, we're still here, but the psychological and physical effects of slavery
Still present.
To this day, to this very day. And especially what Vicky was talking about, you know, we have social media all over the place now. Everybody's recording everything. So you're seeing everything in living color, live as it's happening. You know, that's a whole nother level of trauma. You know, you're sitting in your house, in your bed or wherever, watching this stuff happening to people that look like you, and it's happening just because they look like you. You know?
You know, I saw this statement on there about Black women being weak if they go for mental health. And that is a myth, because we are never weak.
Yeah.
And one thing about, and I wanted to do my PhD on a role reversal in the Black community. Because role reversal, so they take the Black man, beat him to the point of death in front of the woman. So the woman, when she has a son, she gonna tell that son, when master say something to you, don't talk back. Don't do this, because she's trying to preserve his life. And we continue. We're not saying master, don't follow master, but when the police come, keep your hand here. Because we're trying to preserve our children's life. You know, any other child can ask a question, but don't ask any questions. Just do what they say. Keep your hands so they can see you, you know, but now that's not even working. So role reversal has caused mothers to bring their sons in closer and then teach their daughters to be more independent and self-sufficient. And, you know, and I wanted to write about that in the program I was in. she would not allow me to write on that. She said it wasn't enough information, but I believe it's enough historical information to prove role reversal. And you can just look at the Black family, and you can see the role reversal. If these Black women, I'm sure, and any Black woman listening to me that has a son, know how you have drawn your son closer. And you don't draw your daughters close because you haven't seen your daughters murdered like you saw your sons and your husbands murdered, you know. And I told them, as I was saying earlier, I go into white homes, have been for 20 years, but at the same time, I'm praying, God, protect my husband who is Black, protect my son so won't nobody hurt him, protect my Black grandson, but I'm going in giving my white families and all my families everything I have, you know. So how do you live a life double like that? You just do it. Yeah. You just do it.
Michael, I would just like to add a closing question. I've heard that statement many times before about, you know, we made it through slavery. But my question would be, have we made it through? And I just want to leave that on not only people of color's minds, but all people. Have we, as a people, as Black people, as people of color, have we made it through slavery?
Yes.
Thank you all so much. And I think that's a powerful question to end on. So that's something that I think we can all be thinking about throughout the rest of this day. So I'll go ahead and close us out. And I want to remind everyone watching that we do have crisis line information in the comments. So you can look to that right now. If you know anyone at risk of crisis or find yourself at risk of being in a crisis as well. So again, I really appreciate everyone's insight and you all giving your time today to join this conversation, as well as everyone watching to join the conversation. And I'd like to go ahead and remind everyone that this video will be up on our Facebook page afterward, pretty much forever, so you can access it later. Also, we have more information on the Centerstone website. As we're wrapping up National Suicide Prevention Month, you can see those resources on centerstone.org/suicide. And you can also call Centerstone's main phone number, 1-877-HOPE-123. So next week, we'll be hosting a 5th and final Facebook Live chat discussing suicide in the LGBTQ+ community, also at 2 p.m. Central. So again, thank you all so much, and I will let all of our speakers and viewers get back to your days.
Thank you.
Thank you.
Thank you.